It's February 1st, 2021, and we have Andrea Horwath with some questions. Good morning, and thanks for taking my call. We just got the numbers in for the Thunder Bay District Health Unit. There are 10 additional new cases of COVID-19 at the Thunder Bay District Jail. Their outbreak there is continuing to grow, and this morning I got a report of a young man who was picked up on a breach for conditions and then taken to the jail and has now contracted COVID. So obviously whatever they're doing in there isn't enough. And speaking to some of our sources right now, that it looks like what is needed is a human rights inquiry and a way to segregate Indigenous inmates in the jail who seem to be very vulnerable to this. And what can the NDP do to help?
Well, James, thanks for the question. And I know that Judith Monteith-Farrell has been an excellent advocate in Thunder Bay for stopping the spread of COVID-19 and implementing the kinds of initiatives that need to be undertaken to stop that spread. But I mean, we all know the nightmare that the Thunder Bay Jail is and has been for a very long time. We also know that Indigenous folks, First Nations folks, and other Indigenous people from the communities are vulnerable because their health and well-being has been all but ignored by the federal and provincial governments for decades now. I mean, if you're without clean drinking water, for example, if you're without the kind of basics that people expect and need, things like healthcare, things like proper housing, then of course you're going to be in a compromised state in terms of your health and more vulnerable to COVID-19. Even more the reason why, when we know that there is a disproportionate number of Indigenous folks in the jails, why we need to be shoring up the supports in the correction centers, and whether that's making sure that there are more health resources, more, better ventilation, more ability for people to stay apart and not be squeezed together in overcapacity situations. I mean, all of these things are problems in the Thunder Bay Jail, and they needed to be addressed before COVID hit. But it makes it so much more difficult then to stop the spread of COVID-19 when the conditions in the jail are so horrendous. And so Doug Ford needs to spend the money. I mean, that's what needs to be done. Doug Ford needs to spend the money to keep not only inmates, but also the people that work in the correction center, the correction officers and the other, the health staff and everybody else in those facilities and in that particular jail need to know that their workplace is safe. And when people are feeling unwell, if it's staff particularly, they need to be able to take paid sick days to keep themselves and everybody else in the facility safe from the spread of COVID-19.
We've been fighting this for almost a year now. I mean, my first report on COVID was on February the 3rd, and it was 350 worldwide deaths. We've grown a lot since then, unfortunately. One of the issues that I'm seeing is that we seem to be nationwide and Ontario-wide, everybody's firing up about wanting to get the stores open. And I'm wondering if the solution isn't a whole bunch of government support for an extended shutdown to really put this virus on its heels and make things so that we can eventually get back together. I mean, eventually we're going to see this thing happen, but we're not going to have everybody vaccinated until at least the fall.
It's a really good point, James. And I mean, I first want to say that I have so much gratitude for the people of this province who have worked so hard and who are exhausted from trying to do the right things, whether that's look after little ones and educate them, or make sure they're getting some education online, working at the same time from home. So parents who are literally tearing their hair out at this point in time, especially in the parts of Ontario that have not had schools reopen yet, to the small businesses who have lost their livelihoods, who have had to shut down and may never reopen, and to all of those families in long-term care, or with loved ones in long-term care, all of those residents of long-term care who are still vulnerable to contracting the virus, to the just the everyday Ontarians who are having a very, very hard time. And yes, it's been a tough go, but I can tell you it's a tougher go because Doug Ford has not stepped up to the plate to attack this virus from day one. Doug Ford has not acted with any urgency on a number of fronts, and we just heard from our critics describing what some of those fronts are, because he just didn't want to spend the money. Doug Ford wants to try to tackle COVID-19 on the cheap, and that's not going to work. And so, yes, it's a matter of making sure that that people are doing the right thing, but you have to give them the tools to do the right thing. And so, when they're sick, they have to have sick days. If you're asking a business to stay shut down, then you should be providing the bare necessities to help them weather this storm, including things like direct supports for rent. If you're asking, if you're asking, folks to be careful about who they see and what they do, then you have to be clear and you have to communicate clearly what it is that you expect of them, as opposed to the kind of messy and and just confused kind of communications that have been coming from this government from day one. But much of what I've described, and there's much more, as you know, it's going to cost money. But Doug Ford doesn't want to spend the money. And so that's why we're in this lockdown that we're currently in. And so suggesting to go even further would require not only, once again, relying on everyday people, but it would require Doug Ford to actually invest in Ontarians, to spend the money to keep them safe and to help them get through COVID-19 and provide some hope that we could actually stop the spread by doing the right things.
To keep up to date, you have to subscribe. You have to hit that like button and hit the notification to stay in touch.